All right, good morning, everyone. So today we are going to tackle one of the most powerful and frankly, one of the trickiest groups of drugs in all of medicine, the corticosteroids. You have to think of them as a proper double-edged sword. On one side, they can be absolutely life-saving, but on the other, they come with some really serious risks. So let's make sure we get a proper understanding of them today. So here's our game plan for today. First, we'll talk about why we call these drugs a double-edged sword. Then we're going to take a tour of the entire body to see their incredible wide-ranging effects. After that, we'll dive into their main superpower, that anti-inflammatory action, and figure out how they're actually working at a cellular level. Finally, we'll compare the different types available, and this is important, we'll end with a very, very strong word of caution. Okay, so let's start with this central idea: huge benefit versus huge risk. This is the core conflict. The dilemma you will face every single time you even think about prescribing a corticosteroid. Believe me, understanding this balance is absolutely the key to using them wisely in your future practice. Now, to really appreciate just how massive their scope is, let me ask you a question. Just think about it for a second. Can you name any other single class of drug that can influence almost every system in the body? We're talking about the brain, the heart, muscles, bones, literally everything. The answer, of course, is corticosteroids. Their reach is truly systemic, and that is both their greatest strength and their biggest danger. All right then, let's begin our grand tour of the body. We're going to go system by system to see exactly how these glucocorticoids manage to have an effect just about everywhere. Now, I want you to pay close attention, because these systemic effects, they are the very basis for both their therapeutic uses and all of their dangerous side effects. First up, metabolism. Now, a really critical point here is their effect on calcium. You see this? They block its absorption from the gut and they kick it out through the kidneys. This creates what we call a negative calcium balance, which has major implications for bone health later on, so please remember this point. They also help the kidneys get rid of excess water, they ramp up stomach acid production, and then, in a completely different role but one that is vitally important, they help a fetus's lungs to mature right before birth. Amazing, right? Now, moving on to the circulatory system and the blood, corticosteroids are actually essential for keeping our cardiovascular system stable and running. They tighten up leaky capillaries and they maintain the tone of our blood vessels, but they also change the blood report dramatically. They will boost the number of red blood cells and platelets, which seems good, but look here, they cause a sharp drop in key white blood cells like lymphocytes and eosinophils, basically by hiding them away in the tissues. Now, this is really interesting. Check this out. It's a paradox with skeletal muscles. Pay close attention. Both too little steroid, which is hypocorticism, and too much steroid, hypercorticism, will lead to muscle weakness. But, and this is the key, for completely different reasons. If you have too little, it's because of poor circulation. But if you have too much, it's because of things like low potassium and actual muscle wasting. It's a fantastic clinical point to remember for your exams. And of course, we must not forget the brain. Steroids have a very direct effect on the central nervous system. Your patients might tell you they feel a mild euphoria, a sense of well-being, but it can also cause insomnia, dramatic mood swings, even psychosis. And please remember, this isn't just because they are feeling better from their illness. This is a direct chemical effect on the brain itself. Okay, so after seeing all of these widespread effects, let's come to their most famous and really their most important property, their incredible anti-inflammatory power. This, more than anything else, is the #1 reason we use these drugs in so many different diseases. This quote on the slide, it really says it all. Irrespective of the type of injury or insult, the attending inflammatory response is suppressed. What does that mean? It means it doesn't matter what the cause is. Could be an injury, an infection, an allergy. Glucocorticoids will shut down the inflammation. The action is incredibly powerful, but it's also nonspecific. It's like a big wet blanket that just dampens the body's entire inflammatory fire. So how exactly are they doing it? Well, they interfere at multiple steps all along the inflammatory cascade. For one, they make the blood vessels less leaky, which is what reduces swelling. 2, they put up a roadblock so that the inflammatory cells can't rush to the site of injury. And 3, they even interfere with the later stages of healing, like the formation of scar tissue. This is how they suppress all those classic signs of inflammation you learned about: the redness, the heat, the swelling, and the pain. And it goes beyond just general inflammation. They are absolute masters at suppressing the immune system. This includes all types of allergic reactions and what we call hypersensitivity phenomena. They have a particularly strong effect on the part of the immune system driven by T lymphocytes, our cell-mediated immunity. And this is exactly why they are so crucial in treating autoimmune diseases and preventing the rejection of organ transplants. Okay, so far we have seen what they do. Pretty impressive, right? Now let's peek under the hood and understand how they do it. We are going down to the molecular level now to see their very elegant and very clever mechanism of action. So the key player in this whole story is this protein, the glucocorticoid receptor, or GR for short. You can find it just sitting inside the cytoplasm of almost every cell in the body. The steroid molecule floats into the cell, it binds to this receptor, and this whole new complex then travels into the command center, the nucleus. Once it's in there, it acts like a master switch, turning specific genes on or off, changing the very proteins the cell makes. This whole process takes about 30 to 60 minutes, which explains why the effects of steroids are never immediate. This table here brilliantly shows some of those key genetic switches they flip. For example, they switch on the production of proteins called annexins, and these guys block the production of powerful inflammatory molecules like prostaglandins and leukotrienes. At the same time, they switch off the genes for things like COX-2 and various cytokines. And look down here, they even reduce the expression of these sticky molecules, which basically stops immune cells from being able to grab onto blood vessels and cause trouble. It is a multi-pronged attack at the genetic level. Okay, now for the practical, clinical pharmacology. It is so important for you to know that there are many different types of corticosteroids, and they are not all the same. They vary in their strength, in their duration of action, so we must choose the right tool for the right job. This chart gives us a nice, simple classification. You've got two main branches: the glucocorticoids, which primarily deal with inflammation and metabolism, and the mineralocorticoids, which are all about regulating our body's salt and water balance. Now, the glucocorticoids, the ones we're focusing on, are then split up into short, intermediate, and long-acting, based on how long their effects stick around in the body. Now, everyone, this table is extremely important, so please pay attention. It compares the potency, the strength of these drugs. If we take hydrocortisone as our baseline, with a strength of 1, you can see that prednisolone is 4 times as potent. And dexamethasone, it's a whopping 25 times more potent. This is why their equivalent doses are so different. See? You only need a tiny 0.75 milligrams of dexamethasone to get the same anti-inflammatory effect as a full 20 milligrams of hydrocortisone. This is a very, very important point for your exams and for your future practice. And that brings us to our final and maybe the most critical section of this lecture. I really want to leave you with a very strong message of caution. These are incredibly powerful drugs, and they must be used with the utmost respect for their potential to cause serious harm. When you use these for long periods, the list of side effects is long and it's very serious. Patients can develop a typical Cushing's habitus with a round face and fat on their trunk. You can get high blood sugar or hyperglycemia, a much higher risk of infections because you're suppressing the immune system, peptic ulcers from that increased stomach acid we talked about, and osteoporosis from that negative calcium balance we saw right at the beginning. In children, it can even stunt their growth. And critically, it shuts down your body's own natural steroid factory, the HPA axis. This sentence on the slide, you should just burn it into your memory. Indiscriminate use of corticoids is hazardous. Never, ever, ever use them without a very clear reason, and always use the lowest effective dose for the shortest possible time. That is the golden rule. And this right here, this is a critical clinical pearl, a life-saving point. Because long-term use swishes off the body's own adrenal glands, you can never stop these drugs suddenly if a patient has been on them for more than a few weeks. If you do, the body can't make its own essential steroids, and this leads to a life-threatening emergency called acute adrenal insufficiency. They must always, always be tapered off slowly and carefully. So, I will leave you with this final thought. We've seen their incredible power to heal, and we've also seen their frightening potential to cause harm. The real challenge for you as a future doctor is to take this knowledge and use it with great care and great wisdom. So the question is, now that you understand this power, how will you choose to use it? Thank you.